Human teeth are subjected to enormous forces in normal eating, and occasionally to abnormal trauma, such as accidents or biting on a hard object like a cherry seed or chicken bone. Some cracks in teeth are literally unavoidable as we age and not significant, but other cracks are painful and potentially can cause the loss of the affected tooth. This video will show you the various types of cracks in teeth and discuss the significance of each type of crack. It will discuss the treatment alternatives of each type of crack, the advantages, disadvantages of relative types of treatment, the cost for repair, the risks of each treatment, and what happens if you don't do anything. Some knowledge of tooth anatomy is necessary for you to understand the nature of cracks in teeth and their significance. Note on the tooth that has been cut in half the following characteristics. The chewing surface of the tooth is covered with enamel, and it's the hardest substance in the body. It's about a 1/16 of an inch thick. The enamel is only on the part of the tooth that extends into the mouth. It's not on the root surface. The dentin is much softer than the enamel, about 3 or 4 times softer. The dental pulp, or nerve, is what makes a tooth hurt. The dentin has tiny nerve fibers that connect with the pulp. If a crack extends into the dentin, it'll hurt. If it extends into the pulp, it will be extremely painful. We will use the X-ray image of the same tooth as we discuss the characteristics of tooth cracks. As you see, the enamel, dentin, and pulp are clearly shown. As you might expect, there are several types of cracks. Cracks in the enamel only. These are usually not cracks that require any treatment. Cracks into the dentin, usually painful and requiring a crown or a cap, as you might know it, to stop the pain. Cracks into the pulp, with the option of trying a root canal to see if it works, or extracting the tooth. Cracks through the entire tooth, with the options of extracting the tooth or removing part of it, placing a root canal filling in that part, and placing a crown on the remaining root. Now we're going to observe each type of crack and discuss the advantages and disadvantages of each type of treatment. Almost every adult has cracks in enamel. These are caused by eating hard foods, minor accidents, athletic body contact sports, and just plain aging. In this patient, the enamel cracks are visible to the naked eye if you look closely. Enamel cracks are not painful, but occasionally a piece of enamel will break off, requiring some form of treatment. Don't worry about your enamel cracks. Just avoid hard foods and soften the hard food in your mouth before eating it if you are going to eat a hard piece of food. That makes the food softer. Examples are hardtack candy, dried corn nuts, peanut brittle, ice, you know all of the things. We probably shouldn't eat those, but in the meantime, soften them if you're going to eat them. Usually, cracks into the dentin are painful when biting on the cracked tooth in a position that moves that little piece of cracked tooth. The pain's usually very sharp and momentary. Sugar also causes lingering pain in dentin cracks. The crack that is above the gum is easily corrected by removing the cracked piece of tooth and placing a crown or a cap, as you know it, that covers the chewing surface of the tooth. The crack on the right image is into the root surface of the tooth. Sometimes these cracks extend below the supporting bone. If the crack is not below the bone, usually after removal of the cracked piece of tooth, placement of a simple crown will solve the problem. If the crack is below the bone, a surgical procedure to remove a small amount of supporting structure, allowing healing and then placement of a crown, is an alternative. However, this procedure is a time-consuming one because of healing time. It's relatively expensive and sometimes questionable if the crack is deeply below the bone. Ask your dentist about the advisability of attempting to save a deeply cracked tooth. Your alternatives are tooth removal, none of us really want to do that, and placement of a fixed or removable bridge or an implant and a crown. Ask your dentist. This clinical image shows a darkly discolored tooth that's had an old silver filling removed and a crack that apparently extends slightly below the gum. Removal of the cracked piece and placement of a crown would satisfy the situation. The next two images similarly show a simple crack above or slightly below the gum, requiring only removal of a piece and placement of a crown. Cracks into the pulp or nerve usually are very painful and require immediate attention. If you have this type of crack, you would have had pain almost all the time since the crack occurred. This situation presents a difficult decision for you and for your dentist because the outcome of conservative treatment is not totally predictable. This image appears to be a normal-looking tooth with a silver filling in it. However, the tooth was a very painful tooth. As the silver filling was removed, the crack was evident and it went directly into the pulp. When a tooth is cracked into the pulp, this situation presents a difficult decision for you and your dentist. With your dentist's expressed opinion considered, you have the following choices. Remove the tooth and place a fixed or removable bridge or an implant and a crown. Or accomplish root canal therapy and watch the tooth for a period of weeks before placing a crown if it has no pain. If there's still pain, you still have to extract the tooth. Ask your dentist for advice. Fortunately, this condition does not occur frequently, and it occurs in teeth with more than one root. The image shows that the affected tooth has a crack running entirely through it, which separates the tooth into two pieces. This type of crack causes pain whenever you bite on it. You can't avoid it. If left without treatment, these teeth often have infection begin between the two segregated pieces. A clinical example is shown in this image in which the tooth has to be prepared for a root canal. You have only two treatment alternatives. You may remove the entire tooth and replace it with a fixed or removable bridge or an implant and a crown. Or you may remove only a portion of the tooth, which is called a hemisection, accomplish a root canal in the remaining root, place a post and core and crown on the remaining root. Often in these situations, the remaining root should be connected to an adjacent tooth by placing a fixed bridge. Please ask your dentist for an opinion. By now it should be obvious to you that only superficial enamel cracks can be left without any treatment. Sometimes cracks in enamel that have slightly entered dentin are not painful and can be allowed to remain without treatment. However, most cracked teeth require treatment as soon as you feel the pain. Early treatment of a cracked tooth can make for more conservative, less expensive, and less extensive therapy. Don't wait. I'm sorry to tell you, unfortunately, it's relatively expensive to save a cracked tooth. The minimum cost is usually the fee for the crown or cap that's placed on the affected tooth. If the tooth is cracked into the pulp, a root canal is also required with another fee. Perhaps with a post and core buildup, another fee. If the tooth is cracked into two segments, there's a hemisection required usually, and that's another fee. As you can see, there are a lot of uncertainties in the cracked tooth syndrome. Why not just extract the cracked tooth? Replacement of an extracted tooth requires a fixed bridge to be cemented onto the remaining teeth. Or, if other teeth are missing, a removable partial denture to replace all of them, including the cracked tooth. Or dental implants can be placed with crowns over them. However, in spite of the cost of having these tooth replacement treatments, there are times when extraction is the best alternative. Ask your dentist for advice about saving your cracked tooth. It should be pretty obvious to you that there are many factors related to a cracked tooth. I've treated hundreds of them over my career, and I assure you I don't know all the answers. 80% of them can be treated with a simple cap or crown. And as you may remember, if you've had a crown before, there's a temporary restoration placed on for a period of time before the final crown is put on. If during that time that temporary restoration is on, the tooth is not sensitive, by all means save it. On the other hand, if during the temporary restoration the tooth is sensitive, you better talk to your dentist about whether he or she would keep the tooth in their own mouth. There are many times when extraction would be better at that point, but thankfully that's only 20% of the people. Most of these situations can be solved, as I said, by a simple cap or crown. Talk to your dentist.